A study conducted by Johns Hopkins International Injury Research Unit through the Bloomberg Philanthropies Initiative for Global Road Safety shows that road traffic deaths have increased since 2020. In 2018, there were 294 deaths. The injury incidence has been rising to 315 in 2019. There was a slump in 2020 to 236 deaths. The number has since been rising from 419 in 2021 to 425 in 2022. The report goes ahead to reveal death figures by road users. Motorcyclists record the highest number of deaths at 49%, followed by pedestrians at 44%. In a bid to improve road safety by providing quality data, the research went further to make observations of two risk factors: speed and helmet use. The researchers cited 500,000 cyclists to determine who were overspeeding. They also looked at 600,000 cyclists to determine who were using helmets properly. The results were collated between February 2021 and October 2023. The research reveals that the mean speed of vehicles is high at 57 kilometers per hour and mostly among sports utility vehicles or SUVs.
So you might think that 57 kilometers per hour is low, but we know that globally the recommended urban speed limit is 30 kilometers per hour. And so if in Kampala we are seeing 57 kilometers per hour, it means we are way above the speed limit. And we know that beyond 40 kilometers per hour, the chances of survival of someone that has been knocked are very minimal.
Correct helmet use among all motorcyclists was very low at 39% and almost non-existent among passengers.
We saw that only 2% of our passengers are using helmets. And so this really means that the situation is still bad. We need to put in place measures, knowing that helmets save those that are wearing them.
However, the research noted that correct helmet use was highest among rideshare drivers, that is as one accessed through an app such as SafeBorder, at 84%.
By correct helmet use, we mean someone wearing a helmet and strapping it.
The report recommends, among others, enhanced enforcement of speed limits and correct helmet use.
We do a quick review of the literature and synthesize it for you and provide recommendations in terms of, okay, this is what you can do, this is what the best practice is, and this is how you can implement it.
The researchers have been praised for creating a greater understanding of the risk factors in order to enable the implementation of targeted interventions.
The data really is so helpful to us, and that we also continue to go ahead to see how best we can improve in that area. We have a unit in the traffic police that is for speed enforcement, basically.
Police officers, the next time as a report is presented, you have to show us how you have used the research. We shouldn't have just launched it, go keep it. We sign for allowances and tell your boss the whole of today I've been in Hotel Africana. Makerere School of Health Sciences was launching research on traffic. That's not enough. Let us use this research to make a difference in our communities.
We decided to engage the border industries, to regulate. But if we can put our politics aside and say our mandate is to regulate the border industries, I can tell you we shall do it. But when you try and do something, you will get an order coming from somewhere else, you'll get another center point, another place. So we need Kampala safe for each and everybody.